Hey guys, I just wanted to show you what a typical operating room looks like. And this is what ours look like. So it's going to be a little different than the operating room in the main OR because this is actually the OB floor. That's why you see this baby warmer thing. So that's a machine that warms up the baby. There's a heater up here and you press a button and then it'll heat up. I don't really know much about the machine because that's not my thing, but that's basically where the baby goes. So this is all the stuff that I prepared for the nurse. This actually goes underneath the patient when we move them. It's like a little sliding thingy. It shows you on the picture. So you throw that away when you're done. Then you have your Bovie, your warmer. And the supplies are already pre-picked because everybody uses the same thing except for gowns, gloves, and suture. This is the C-section pack that we have. I believe I've shown this in my other video where I've broke down what was on here. So that's basically what we have. That is our C-section pack. That's the sharp container. This is the warmer. And so it goes like that. And so you drape this and then you turn it on when your nurse pours you the liquid. This is our gloves and suture. It's actually smaller than I'm used to because in the main OR they have a whole room for all the gloves and there's a lot of glove type that is missing actually here. So they're missing a Eclipse and some other ortho gloves, but this is basically what they use. The yellow ones are the Ultra Touch. They are latex free, and also the blue one are latex free. Sensors, no worry, nobody really uses these sensors. That's why they're all really packed up. Only one size because only one doctor uses that. And so yeah, and then the surgeons is what I currently use at this hospital, but in other hospital I use Eclipse, which they don't have here. It's more flexible and more comfortable on my fingers, and these surgeons are a bit tight for me. So that's what we have. And then here we have our drawers of some supplies. So you have some vacutainers, some specimen cups, Bovies. These are called light handles. These are the weird ones that I don't like. And then the warmer drape that goes in the other thing. This is also a warmer drape, this is just a different company. And then we have some laps, some ABD, some Telfa, and some badge packing. And we have here some Mediport tape, bear hugger that goes on the table, so it looks like this. That's the orientation of how you should put it. So this basically hooks up to that machine and it warms up the patient. And then you have some pads here, and this goes to the candy cane stirrups when they do DNCs. And then some random stuff here, some Arista. This is a hemostatic agent, and some bulb syringe, and this is actually a staple removal, which we don't use here really. And then in this cabinet, it's pretty messy. So we have some drape sheets over here. Actually, that's this one is a half sheet. I don't know why they call it drape sheets. We have covers, some drains. We don't really use that much here. Some Ratex towels, the Insorbs, the regular staplers. So these are the labels, markers. This is a pull suction tip, and this is the plastic one, and some trays actually have the metal ones, which I prefer than this one. some Yankauer tips, some suction tubing, and this is what our trays look like. Ligature, some extra basin down there. So that's what we have here. And then here we have some suction, and some hospitals they do use this thing called Neptune. I'll show you guys those machines in a different video. These are actually some machine that I don't really like because they don't suck that hard, and I don't know, I just don't like it. And this is actually the first time I've used them in this hospital, so basically I don't want to touch it because, you know, bacteria and stuff. So all you have to do is put in this liner. This liner inside it is disposable, so when the blood goes in there, all you have to do is put some solidifier and dispose it. That's how you take it out. So you just turn it on like that and it'll suck down here, and this is where the suction is gonna hook up to. So yeah, it doesn't suck that hard, so that's why I don't like it. So I don't know, this thing is like caught like that. It sucks. No one's gonna fix that. Okay, so this is what we have here. Computer and the Pyxis, and this is the anesthesia machine. Yep, that's what it is. I don't know how to use that machine. So yeah, and this is the linen, and yep. So hopefully you guys like this video, and I'll see you guys later.